1. Trump administration's $50 billion plan to save rural hospitals. 2. Will Trump's $50 billion rural health fund save struggling hospitals? Experts weigh in. 3. Rural health slush fund. Questions and skepticism over $50 billion allocation. 1. Trump administration's $50 billion plan to save rural hospitals. Imagine a healthcare crisis looming over rural America, threatening the very hospitals that serve some of our nation's most vulnerable populations. But here's where it gets controversial. The Trump administration has unveiled a $50 billion plan to bolster rural hospitals, aiming to prevent widespread closures amid impending Medicaid cuts set for 2027. This move is stirring up significant debate among lawmakers from both parties, particularly in rural areas where healthcare access is already strained. Dr. Mehmet Oz, the newly appointed administrator of the Centers for Medicare and Medicaid Services, CMS, emphasized the urgency and scope of this initiative. "We're working at breakneck speed," he stated, highlighting the need for immediate action. Oz, who was appointed by former President Donald Trump, views the fund as a cornerstone of a broader strategy to revamp rural healthcare systems. "Innovation is key," he explained. "Our goal is to train more medical professionals for underserved areas and engage additional providers in the healthcare network." This ambitious plan, part of what Trump dubbed his Big Beautiful Bill, addresses growing concerns highlighted by a Congressional Budget Office (CBO) report. The report warns that up to 11 million Americans could lose their Medicaid coverage in the coming years due to eligibility reassessments and budget reductions. Rural communities, already grappling with a surge in hospital closures, stand to be hit hardest. According to data from the Kaiser Family Foundation, a staggering 44% of rural hospitals are currently operating at a loss. While the proposed $50 billion fund is viewed as a crucial lifeline, experts caution that it may only cover about 1/3 of the anticipated shortfall from Medicaid funding cuts. Recognizing this gap, Senator Josh Hawley, Republican Missouri, has introduced legislation to increase the Rural Hospital Fund over the next 8 years. "We must ensure no cuts to rural hospitals," Hawley declared, emphasizing the importance of sustained support. On the other hand, Democrats argue that Republicans are attempting to mask the true impact of these cuts. Representative Ted Lieu, Democrat California, criticized the approach, stating, "For any Republican claiming these weren't actual cuts to Medicaid, this plan exposes the lie." The debate underscores the complex political dynamics surrounding healthcare reform and the challenges of balancing fiscal responsibility with public health needs. Dr. Oz announced that states can start applying for the new rural health care funds beginning in September. However, he did not specify which hospitals or regions would receive priority. This ambiguity has sparked further speculation and anticipation among stakeholders. As this critical issue unfolds, it raises important questions about the future of rural healthcare in America. How can we best support these vital institutions while navigating the complexities of healthcare policy? Your thoughts on this matter are valuable. Please share your perspectives in the comments. 2. Will Trump's $50 billion rural health fund save struggling hospitals? Experts weigh in. The uncertainty surrounding whether President Trump's allocation of $50 billion for rural health care will suffice is palpable. Congress has earmarked this substantial sum to support rural hospitals and medical providers, aiming to mitigate concerns over the unprecedented cuts to federal health care spending that Trump enacted on Independence Day. But the pressing question remains: is this financial aid sufficient to rescue the beleaguered rural hospitals? Alan Morgan, the CEO of the National Rural Health Association, a nonprofit organization focused on rural health policy, expressed his doubts, stating, "I have more questions than I have answers. No one has those answers yet." He pointed out that the new funding, which is intended to be utilized over a 5-year period, pales in comparison to the staggering $155 billion in projected cuts to rural Medicaid spending over the next decade, as estimated by KFF, a nonprofit health policy and research organization. There is a growing concern among experts, hospital administrators, and lawmakers from both political parties that Trump's legislation could severely impact rural hospitals and clinics. These facilities often serve a disproportionately high number of patients who rely on Medicaid, the joint federal-state health insurance program for low-income individuals. The new law proposes to cut over $1 trillion from Medicaid over the next 10 years, a move that critics argue primarily benefits wealthier individuals through tax reductions. The introduction of the $50 billion fund was a strategic maneuver by Republican leaders in Congress to secure the support of party members who were initially hesitant to endorse such drastic reductions in Medicaid and other health services. In the Senate, this rural health initiative played a crucial role in garnering votes, including that of Alaska's moderate Republican Senator Lisa Murkowski, who voiced her concerns regarding the law's potential repercussions on health care in her state. Notably, approximately one-third of Alaskans are covered by Medicaid. Jared Kazan, the president and CEO of the Alaska Hospital and Healthcare Association, expressed his deep frustration with the cuts to Medicaid funding, which he believes will have long-lasting negative effects on Alaskans. He criticized the Republicans for opting to simply inject funds into a program rather than exploring more sustainable solutions. It's frustrating in the public realm when decisions like this are made fast and, frankly, carelessly, he remarked. The consequences are going to fall on us, not them. The law's funding cuts are particularly concentrated in 12 states with significant rural populations that expanded Medicaid under the Affordable Care Act. These states include Illinois, Kentucky, Louisiana, Michigan, Minnesota, Missouri, New York, North Carolina, Ohio, Oklahoma, Pennsylvania, and Virginia. Some Republican lawmakers have touted the $50 billion Rural Health Fund as a significant achievement in healthcare policy. However, it remains unclear which specific hospitals, clinics, and providers will benefit from this funding and to what extent. ###How the funding works. The Rural Health Transformation Program is set to distribute $10 billion annually from fiscal years 2026 to 2030. States are required to submit applications for their share of the funding by the end of this year, detailing how they plan to utilize the resources. According to an analysis from the Bipartisan Policy Center, the law specifies several potential uses for the funds, including providing financial support to rural hospitals to maintain essential services like emergency care and maternity services, recruiting and training healthcare professionals in rural areas, including doctors and nurses, enhancing emergency medical services, such as ambulances and emergency medical technicians, EMTs, implementing new technologies including telehealth services, offering treatment for opioid use disorders and mental health services, improving preventive care and managing chronic diseases. Each year, half of the $10 billion will be evenly distributed among states that have applied for it, while the remaining half will be allocated at the discretion of the administrator of the Federal Centers for Medicare and Medicaid Services, currently Dr. Mehmet Oz, based on factors such as the rural population and health facilities in each state. While this program does not fully compensate for the anticipated losses states will face, Morgan believes it presents an opportunity to rethink the funding structure for rural health care. He advocates for giving states more flexibility in how they utilize these funds, emphasizing the importance of focusing on preventive care to keep rural communities healthy while ensuring hospitals remain operational. If done correctly, it could really change the future course for rural America, Morgan stated, acknowledging the challenge of achieving this goal. ###, the states most affected. Kentucky is projected to suffer the most significant impact from the new law's cuts to rural Medicaid funding, with an estimated loss of $12 billion over the next decade, according to KFF's analysis. The state's Medicaid department is currently awaiting further federal guidance to clarify how these changes will affect its program. Kendra Steele, a spokesperson for the Kentucky Cabinet for Health and Family Services, highlighted that over 1.4 million Kentuckians depend on Medicaid, including half of all children in the state, seniors, and other vulnerable populations. The federal legislation's passage will have serious implications for these individuals, rural health care, hospitals, and local economies. Even with the introduction of the new program, states nationwide will need to reassess their budgets in light of the cuts, according to Hemi Tuerson, executive director of the National Academy for State Health Policy, a nonpartisan organization that assists states in developing healthcare policies. Every region is slightly different, and there's not a one-size-fits-all approach, she noted. Hospital ownership varies, as do the types of services that are critical for the communities they serve. They must explore innovative ways to deliver these services amid dwindling resources. Currently, about 44% of rural hospitals are operating at a loss, a higher percentage than the 35% of urban hospitals, according to KFF's analysis of RAND hospital data. #### The definition of rural. Before the bill's passage, Dr. A sought to reassure U.S. House Republicans that even districts not classified as strictly rural could still access funds from the program. Pennsylvania Republican U.S. Representative Rob Bresnahan indicated that funding could begin flowing to his district as early as next year, having met with Trump, Oz, and others to secure commitments that hospitals in his area would benefit from the fund. His district encompasses both suburban and rural regions, including the cities of Scranton and Wilkes-Barre. Despite the legislation providing guidelines for determining which facilities or areas qualify as rural, Morgan anticipates a rush among lawmakers and providers to claim rural status to secure funding. That's going to be a huge issue, defining who's rural, he remarked. We're all rural at heart when it comes to money. 3. Rural Health Slush Fund. Questions and skepticism over $50 billion allocation. The introduction of a $50 billion rural health initiative has sparked a mix of hope and confusion among healthcare leaders across the nation. This last-minute addition to President Donald Trump's extensive tax and spending legislation aims to allocate $10 billion annually to states for 5 years, commencing in fiscal year 2026. However, as Sarah Homan, the Director of Government Affairs at the National Association of Rural Health Clinics, aptly noted, the devil's in the details when it comes to implementation. Homan expressed optimism about this significant investment, stating, "This kind of funding for rural health is what we and other advocates have been striving for over a long period." Her organization represents 5,600 rural health clinics, highlighting the importance of this funding for their operations. Residents in rural America face numerous health challenges, including higher rates of chronic diseases, lower life expectancy, and reduced income levels. These factors have severely impacted the financial stability of rural healthcare systems, leading to hospital closures and the reduction of essential services such as obstetrics and mental health care. Approximately 25% of individuals living in rural areas rely on Medicaid, the joint state and federal program designed for low-income and disabled individuals. In light of heated discussions among Senate Republicans regarding cuts to Medicaid spending, the introduction of the $50 billion program was seen as a strategic move to mitigate dissent. Nevertheless, many health advocates and researchers remain skeptical about whether this funding will sufficiently counterbalance anticipated reductions in federal support. Senate Majority Leader John Thune, a Republican from South Dakota, which has a significant rural population, spearheaded the effort to pass the budget bill. His website emphasizes his commitment to enhancing healthcare access in rural regions. However, his office has not provided comments regarding the rural health program included in the legislation. Similarly, Senator Susan Collins from Maine, who initially proposed the amendment to incorporate the rural program, has not responded to inquiries. On July 15, Senator Josh Hawley from Missouri introduced a bill aimed at reversing future Medicaid cuts and expanding the rural program. Michael Cannon, Director of Health Policy Studies at the Cato Institute, a libertarian think tank based in Washington, D.C., criticized the allocation of funds, suggesting that it was politically motivated rather than focused on the needs of rural patients. He stated, "As long as it's a government slush fund where political decisions dictate the distribution of funds, there will be a disconnect between where the money goes and what consumers actually require." The nonpartisan Congressional Budget Office has projected that federal Medicaid spending will decrease by approximately $1 trillion over the next decade. Frederick Blavin, a senior fellow at the Urban Institute, emphasized that these financial figures translate into real consequences for individuals. Many states expanded their Medicaid programs under the Affordable Care Act, which has led to reduced medical debt, improved health outcomes, and even lower mortality rates, according to Blavin. However, by 2034, it is estimated that around 11.8 million individuals could lose their health insurance due to this legislation, with Alice Burns, an associate director for KFF's program on Medicaid and the uninsured, warning that the rollback of Medicaid could disproportionately affect rural communities. In rural areas, federal Medicaid funding is anticipated to decline by $155 billion over the next 10 years, as per an analysis by KFF, a nonprofit health information organization. Burns pointed out that if the rural program's objective is to transform healthcare in these areas, it is unlikely to succeed, as the $50 billion allocated over 5 years will not compensate for the expected losses from a decade of Medicaid cuts. Carrie Lutz, the chief executive of Holton Community Hospital in Kansas, expressed a cautious optimism, stating, "I don't feel that the sky is falling right now." Her hospital, which has only 14 beds, is preparing for potential reductions in Medicaid patients and limitations on provider taxes, which most states utilize to secure additional federal Medicaid funding. Although the reduction in provider taxes has been postponed until fiscal year 2028, Lutz is eager for her state's leaders to apply for a share of the rural program funding, which is expected to be available sooner. "Every little penny helps when you're starting with very tight margins," she remarked. The $50 billion allocated for the program will be distributed over 5 years and may not be exclusively dedicated to supporting rural areas or their healthcare facilities. Half of the funds will be allocated equally among states that apply and receive approval from the Centers for Medicare and Medicaid Services. This raises concerns that smaller states, like Vermont, could receive the same funding as larger states, such as Texas. States must submit a comprehensive rural health transformation plan by the end of this year, as mandated by the law. The legislation outlines that states should utilize the funds to achieve objectives such as enhancing access to healthcare providers, improving health outcomes, creating economic opportunities for healthcare workers, and prioritizing the adoption of emerging technologies. Mehmet Oz, a Trump appointee overseeing Medicare and Medicaid, will be responsible for determining the distribution of the remaining $25 billion, using a formula based on the rural population and needs of each state. The law specifies that these funds should be used for initiatives like increasing the use of robotics, enhancing cybersecurity, and assisting rural communities in optimizing their healthcare delivery systems. Despite inquiries, representatives from CMS have not provided responses. Kyle Zebley, Senior Vice President of Public Policy at the American Telemedicine Association, noted that there is considerable discretion for the White House and the Medicare and Medicaid administrator in approving state plans. "We will encourage states to incorporate robust telehealth and virtual care options in their proposals to the federal government," Zebley stated. Alexa McKinley-Abel, Government Affairs and Policy Director for the National Rural Health Association, highlighted the uncertainty surrounding which state agencies will be responsible for creating and submitting these plans. "There are significant gaps in the application and implementation process," she noted, referencing an earlier version of the bill that required state plans to be developed in collaboration with federally funded state offices of rural health. However, these offices are proposed to be eliminated in Trump's federal budget, which will require congressional approval in the fall. McKinley-Abel expressed her organization's support for state offices of rural health to assist in developing the plans and collaborating with states to distribute the funds, as they possess intimate knowledge of the rural health landscape. Homan, from the Rural Health Clinic Association, expressed uncertainty about whether the transformation program funds will reach her members, noting that approximately 27% of patients treated at rural health clinics are enrolled in Medicaid. "There's just some confusion about who will ultimately receive this funding," Homan remarked. "What will it actually be used for?" This report also includes contributions from Phil Galewitz, a senior correspondent for KFF Health News, a national newsroom dedicated to producing in-depth journalism on health issues and a core program of KFF, an independent source for health policy research, polling, and journalism.